Each day, millions of Americans struggle with the impacts of bladder conditions and diseases. And these impacts on an individual's health, it affects their quality of life, the result in significant health costs. So we're kind of asking, what are the common signs, the symptoms you should be aware of? And joining us to discuss some of the signs and symptoms patients often are too embarrassed to bring up to their doctor, Dr. Kathleen Kobashi. Thanks for stopping by, Doctor.
Thank you for having me, Mike. Well, November...
Go ahead, I'm sorry.
Hello? Oh, I'm sorry. I was just going to say November is National Bladder Health Month. So it's the time of year when the Urology Care Foundation really wants to raise public awareness and enable or empower patients to ask about their bladder conditions and take control of their bladder health.
Right, you're right. National Bladder Health Month. It's a good time to get patients to focus on the importance of taking, I guess, an active role in your bladder health. That's really the whole point of this, right?
Indeed, that's exactly right.
Yeah, what is the impact of bladder health in America? Well, I guess, what are we seeing overall?
Well, millions of Americans are affected by a variety of different bladder conditions that can range from urinary leakage, leaky bladders, to urinary tract infections, to something more serious like bladder cancer. So if you have any symptoms, anything that suggests that your bladder isn't quite functioning right or behaving right, it's important to ask your healthcare provider or visit us online at urologyhealth.org, which is the Urology Care Foundation website that has a lot of great information for patients.
Yeah, this really impacts a lot of people, more people than would care to admit. But I guess what are some common bladder issues and some of those symptoms that I guess people might ignore?
Right. Well, some of the things include leaky bladder, so that can have a huge impact on quality of life. If your bladder feels like when it's got to go, it's going to go right now, whether you want it to or not. Leaky bladder with exercise or coughing or laughing, that can have a huge impact as well. So there are great treatment options that are available for those things. Also, recurrent urinary tract infections, a very common problem that results in upwards of 8 million hospital visits or doctor visits a year. So there are things that we can do to prevent those from happening. Nighttime frequency, also a huge problem. If it's keeping you awake and keeping you from getting a good night's sleep, big impact, and so we can do things to take care of that. And as I mentioned, something more serious like bladder cancer. Yeah. So I would say, if you have symptoms like, even a drop of blood in the urine, even if it goes away, it is important for you to take that seriously and talk to your healthcare provider. Yeah,
that's good to know. That's a great point too. But I heard you talk a couple times about treatment options. How are bladder issues treated?
Of course, it depends on which of those bladder conditions that you are experiencing, but leaky bladder can be something as simple as dietary changes, avoiding things that irritate the bladder like a big cup of coffee or a glass of wine. Not to say that you can't have those things, but you just want to be a little bit strategic about when you take those things. Pelvic floor exercises and some lifestyle changes. For nighttime frequency, it might be as simple as just adjusting when you take your fluids. You don't drink right up until the time you go to bed at night. Sometimes adjusting some medications. Some people are on medications that make you create more urine to get rid of excess fluid, and just changing the time that you take that medication. Urinary tract infections, there are things, of course, we will treat the urinary tract infections, but if we can prevent it altogether, that's also something that can be very impactful on a patient's quality of life. And then lastly, bladder cancer, of course, should you unfortunately have that diagnosis, that's treated on an individualized basis depending on the type of bladder cancer that you have.
Yeah, Dr. Kobashi, they're telling me we've got to wrap this up, but is there any one thing you want our viewers to know about bladder health as we exit here?
Well, thank you. I would again encourage people to go to urologyhealth.org where there's great information. I think it's just important for people to know that you're not alone and there are many successful treatment options that are available.
Yeah, and do not be afraid to talk to your doctor about it. Doctor?
Absolutely.
Thanks for your time this morning.
Thank you.
All right.
Thank you for having me.
You bet. Mary, over to you.